A nurse is teaching a patient about self-monitoring while taking a beta blocker at home. The nurse should teach the patient to take his apical pulse daily for 1 minute. If the pulse rate decreases to less than 60 beats per minute, the nurse instructs the patient to do which of the following? A. Contact his physician for instructions. B. Reduce the dose of his beta blocker by half. C. Continue the medication because this is an expected effect. D. Skip the medication dose that day and check his pulse again the next day. Answer. A. Contact his physician for instructions. Rationale. Cardiac depression can occur with beta blockers. The patient should be told to contact his physician if his pulse rate decreases to less than 60 beats per minute. Which of the following drugs is used to help establish the diagnosis of pheochromocytoma? A. Prazosin, Minipress. B. Phentolamine, Rogitine. C. Carvedilol. D. Ergotamine tartrate, Ergostat. Answer. B. Phentolamine, Rogitine. Rationale. Phentolamine is used in the diagnosis of this catecholamine-secreting tumor. A 49-year-old male patient is in the clinic for a follow-up visit 6 months after starting a beta blocker for treatment of hypertension. During this visit, his blood pressure is 169/98 of a millimeter of mercury. And he eventually confesses that he stopped taking this medicine 2 months ago because of an embarrassing problem. What problem did he most likely experience with this medication that caused him to stop taking it? A. Urge incontinence. B. Dizziness when standing up. C. Excessive flatus. D. Impotence. Answer. D. Impotence. Rationale. Impotence is a potential adverse effect of beta blockers and may cause patients to stop taking the medication when beta blocker is indicated for the treatment of heart failure. A. Atenolol, Tenormin. B. Carvedilol. C. Acebutolol, Rotril. D. Esmolol, Brevibloc. Answer. B. Carvedilol. Rationale. Certain beta blockers such as carvedilol and metoprolol have had the best results to date in the treatment of heart failure. A female patient has been admitted to the emergency department after an accidental overdose of ergotamine tartrate, Ergostat. Her daughter states that her mother developed a severe migraine headache and called to tell her that she had taken 2 double doses that morning because the headache just would not go away. She is now dizzy, nauseated, and very weak. Which of the following actions should the nurse take immediately? A. Administer activated charcoal. B. Force intravenous and oral fluids. C. Empty the stomach by gastric lavage. D. Administer a cathartic such as sorbitol. Answer. C. Empty the stomach by gastric lavage. Rationale. In an acute ergotamine tartrate overdose, the patient's stomach should be emptied immediately either by inducing emesis with syrup of ipecac or by gastric lavage. A patient has received a prescription for prazosin, Minipress, to reduce urinary obstruction due to benign prostatic hyperplasia, BPH. What important information should the nurse tell this patient about the medication? A. Fluids should be restricted while on this medication. B. Take the medication with breakfast to promote maximum effects of the drug. C. Until a tolerance is built up, lightheadedness may occur when standing up after sitting or lying down. D. Blood pressure should be monitored because the medication may cause hypertension due to vasoconstriction. Answer. C. Until a tolerance is built up, lightheadedness may occur when standing up after sitting or lying down. Rationale. This medication is used to relieve impaired urinary flow in men with BPH. but it also has antihypertensive effects. Because of these effects, the blood pressure may become dramatically lowered. And orthostatic hypotension and lightheadedness may occur until tolerance is developed. A 58-year-old male has had a myocardial infarction, MI. He has begun rehabilitation and is ready for discharge. When he is given a prescription for metoprolol, Lipressor, he becomes upset, stating, "I don't have high blood pressure. Why did my doctor give me this medicine?" Which of the following statements is the nurse's best explanation to the patient? A. This medication prevents emboli that may lead to another MI. B. Beta blockers are routinely prescribed for all post-MI patients. C. It is being prescribed to prevent hypertension that often occurs post-MI. D. Studies have shown that this medication has greatly increased survival in patients after an MI. Answer: D. Studies have shown that this medication has greatly increased survival in patients after an MI. Rationale: because of their cardioprotective properties. Beta blockers are frequently prescribed to patients after they have suffered an MI. However, some contraindications may preclude the use of beta blockers for all post-MI patients. A patient has been on a dopamine drip, and the nurse notices that the infusion has extravasated into the tissue of the forearm. After stopping the infusion, the nurse immediately injects phentolamine subcutaneously in a circular fashion around the extravasation site. What is the effect of this action? A. It causes vasoconstriction and rapid uptake of the extravasated dopamine. B. It causes arterial vasoconstriction and reduced pain and swelling at the site. C. It increases peripheral vascular resistance and reduces arterial pressure at the site. D. It increases blood flow to the ischemic site by vasodilation and prevents permanent tissue damage. Answer: D. It increases blood flow to the ischemic site by vasodilation and prevents permanent tissue damage. Rationale: phentolamine is an alpha blocker that reduces peripheral vascular resistance when given systemically. But local subcutaneous (SC) injection around extravasated vasoconstrictive drugs such as dopamine causes an alpha-adrenergic receptor blockade and vasodilation, thus increasing blood flow to the ischemic tissue, which may prevent permanent tissue damage. A patient is going home with a new prescription for the beta blocker atenolol, Tenormin. What important information should the nurse tell the patient about this drug? A. Never abruptly stop taking this medication. B. The medication should be stopped once symptoms subside. C. Change positions slowly to prevent or reduce postural hypotension. D. Report any weight gain of more than 0.91 kilograms, 2 pounds, in a week or any problem with fluid buildup. Answer: A. Never abruptly stop taking this medication. Rationale: patients should be weaned off these medications slowly because rebound hypertension and chest pain are possible with rapid withdrawal. The nurse is reviewing the mechanism of action of alpha-adrenergic drugs. Adrenergic blockade at the alpha receptors leads to which effects? Select all that apply. A. Meiosis. B. Vasodilation. C. Vasoconstriction. D. Bradycardia. E. Reduced blood pressure. Answer: A. Meiosis. B. Vasodilation. E. Reduced blood pressure. A patient is taking an alpha blocker as treatment for benign prostatic hyperplasia. The nurse will monitor for which potential drug effects. Select all that apply. A. Orthostatic hypotension. B. Increased blood pressure. C. Increased urine flow. D. Headache. C. Bradycardia. Answer: A. Orthostatic hypotension. C. Increased urine flow. D. Headaches. A patient who has recently had a myocardial infarction, MI, has started therapy with a beta blocker. The nurse explains that the main purpose of the beta blocker for this patient is to A. Cause vasodilation of the coronary arteries. B. Prevent hypertension. C. Increase conduction through the SAW node. D. Protect the heart from circulating catecholamines. Answer: D. Protect the heart from circulating catecholamines. Before initiation therapy with a non-selective beta blocker, the nurse will assess the patient for a history of which condition? A. Hypertension. B. Liver disease. C. Pancreatitis. D. Asthma. Answer: D. Asthma. Nurse providing teaching for a patient who has a new prescription for beta-1 blockers will keep in mind that these drugs may result in which effect? A. Tachycardia. B. Tachypnea. C. Bradycardia. D. Bradypnea. Answer: C. Bradycardia. Rationale: beta-1 blockers are drugs that are used to treat angina and arrhythmias. Educating patients who are to be administered with these drugs should include that the drugs might cause a lowered heart rate. These drugs do not increase the heart rate to produce tachycardia. Thus, the option A is incorrect. Tachypnea is a condition characterized by an abnormally high rate of breathing. Beta blockers do not include tachypnea as a side effect. Thus, the option B is incorrect. Bradypnea is a condition characterized by an abnormally low rate of breathing. Beta blockers do not include bradypnea as a side effect. Thus, the option D is incorrect. Beta-1 blockers function by lowering the heart rate and blood pressure. Also, they restore normal rhythm of the heart. One of the effects of such drugs is to induce lowered heart rate, a condition known as bradycardia. When administering beta blockers, the nurse will follow which guideline for administration and monitoring? A. The drug may be discontinued at any time. B. Postural hypotension rarely occurs with this drug. C. Tapering off the medication is necessary to prevent rebound hypertension. D. The patient needs to stop taking the medication at once if he or she gains 3 to 4 pounds in a week. Answer: C. Tapering off the medication is necessary to prevent rebound hypertension. Rationale: beta blockers are drugs that are used to treat hypertension, angina, and increased cardiac rhythm. Such drugs should be tapered down and not discontinued abruptly at any time. Thus, the option A is incorrect. Beta blockers can induce postural hypotension as these are antihypertensive drugs. Thus, the option B is incorrect. Beta blockers are antagonists of beta-adrenergic receptors and function for the reduction of blood pressure and setting right cardiac arrhythmias. These drugs can interfere with glucose metabolism, and a slight increase in the body weight of patients administered with these drugs is considered normal. Thus, the option D is incorrect. Care should be taken while administering beta blockers as sudden cessation will result in rebound hypertension. This situation can be avoided by tapering off the medicine. When a patient has experienced extravasation of a peripheral infusion of dopamine, the nurse will inject the alpha blocker phentolamine, Regitine, into the area of extravasation and expect which effect? A. Vasoconstriction. B. Vasodilation. C. Analgesia. D. Hypotension. Answer: B. Vasodilation. Rationale: the given example presents a patient who had experienced extravasation of dopamine peripheral infusion. Injecting the alpha blocker phentolamine, Regitine will produce dilation of the blood vessels and not constriction of blood vessels. Thus, the option A is incorrect. The drug phentolamine, Regitine, is a beta blocker and causes vasodilation and not analgesia. Analgesic drugs induce relief from pain and Regitine is not an analgesic drug. Thus, the option C is incorrect. Hypotension is characterized by lowered blood pressure and the drug phentolamine, Regitine, does not cause hypotension. Thus, option D is incorrect. The drug phentolamine, Regitine, is used therapeutically to treat hypertension and induces vasodilation. During therapy with a beta blocker, the patient notices that she has swollen feet, has gained 3 pounds within 2 days, feels short of breath even when walking around the house, and has been dizzy. The nurse suspects that which of the following is occurring? A. The patient is experiencing an allergic reaction. B. The patient may be developing heart failure. C. More time is needed for the patient to see a therapeutic response to the drug. D. The patient is experiencing expected adverse effects of the drug. Answer: A. The patient is experiencing an allergic reaction. Rationale: patients need to be weaned off these medications slowly because rebound hypertension and chest pain are possible with abrupt withdrawal. The drugs should never be stopped abruptly, nor doses skipped. First dose hypotension occurs with alpha blockers. The patient has a new prescription for tamsulosin, Flomax, as treatment for benign prostatic hyperplasia. The nurse is checking his current medication list and will contact the prescriber regarding a potential interaction if the patient is also taking which drug? A. Levothyroxine, Synthroid, for hypothyroidism. B. Sildenafil, Viagra, an erectile dysfunction medication. C. Omeprazole, Prilosec, a proton pump inhibitor. D. Low-dose aspirin for stroke prevention. Answer: A. Levothyroxine, Synthroid, for hypothyroidism. Rationale: orthostatic hypotension can occur with any dose of an alpha blocker, and patients must be warned to get up slowly from a supine position. The other responses are not drug effects of alpha blockers. During a teaching session about self-monitoring while taking a beta blocker at home, the nurse has taught the patient to take his apical pulse daily for 1 minute. If the pulse rate decreases to less than 60 beats per minute, the nurse will instruct the patient to A. Notify his prescriber. B. Reduce the dose of his beta blocker by half. C. Continue the medication because this is an expected effect. D. Skip the medication dose that day, and check his pulse again the next day. Answer: D. Skip the medication dose that day, and check his pulse again the next day. Rationale: impotence is a potential adverse effect of beta blockers and may cause patients to stop taking the medication. The other options are not adverse effects of beta blockers. A patient is experiencing diastolic heart failure. The nurse expects which beta blocker to be ordered for this patient? A. Atenolol, Tenormin. B. Carvedilol, Corig. C. Acebutolol, Sectrol. D. Esmolol, Brevibloc. Answer: A. Atenolol, Tenormin. Rationale: cardiac depression can occur with beta blockers. Instruct the patient to contact his prescriber if his pulse rate decreases to less than 60 per minute. The medication dose may need to be changed, but it is not appropriate for the nurse to change the dosage. The other options are incorrect. The nurse is screening a patient who will be taking a nonspecific, non-selective beta blocker, which condition, if present, may cause serious problems if the patient takes this medication? A. Angina. B. Hypertension. C. Glaucoma. D. Asthma. Answer B. Hypertension rationale. Not all beta blockers are used for the treatment of heart failure. Carvedilol and metoprolol are currently used in the treatment of heart failure. The other options are not indicated for the treatment of heart failure. Teaching for a patient who is taking tamsulosin, Flomax, to reduce urinary obstruction due to benign prostatic hyperplasia. Will include which of these? A. Fluids need to be restricted while on this medication. B. Take the medication with breakfast to promote the maximum effects of the drug. C. Get up slowly from a sitting or lying position. D. Blood pressure must be monitored because the medication may cause hypertension. Answer D. Blood pressure must be monitored because the medication may cause hypertension. Rationale. Non-specific, non-selective beta-blocking drugs may precipitate bradycardia, hypotension, heart block, heart failure, bronchoconstriction, and/or increased airway resistance. Therefore, any pre-existing respiratory condition such as asthma might be worsened by the concurrent use of any of these medications. A 58-year-old man has had a myocardial infarction, MI, has begun rehabilitation, and is ready for discharge. He is given a prescription for metoprolol, Lipressor, and becomes upset after reading the patient education pamphlet. I don't have high blood pressure. Why did my doctor give me this medicine? Which explanation by the nurse is correct? A. This medication will prevent blood clots that may lead to another heart attack. B. Beta blockers will improve blood flow to the kidneys. C. This drug is prescribed to prevent the high blood pressure that often occurs after a heart attack. D. Studies have shown that this medication has greatly increased survival rates in patients who have had a heart attack. Answer C. This drug is prescribed to prevent the high blood pressure that often occurs after a heart attack. Rationale. This medication is used to relieve impaired urinary flow in men with benign prostatic hyperplasia. But it also can cause orthostatic hypotension when changing positions from sitting or lying positions. Because of these effects, the blood pressure may become dramatically lowered, and lightheadedness may occur, increasing the risk of falling during initial rounds. The nurse notes that a dobutamine infusion has extravasated into the forearm of a patient. After stopping the infusion, the nurse follows standing orders and immediately injects phentolamine, Regitine, subcutaneously in a circular fashion around the extravasation site. What is the mechanism of action of the phentolamine in this situation? A. It neutralizes the extravasated dobutamine immediately. B. It causes arterial vasoconstriction and reduced pain and swelling at the site. C. It increases peripheral vascular resistance and reduces arterial pressure at the site. D. It increases blood flow to the ischemic site by vasodilation to prevent tissue damage. Answer D. It increases blood flow to the ischemic site by vasodilation to prevent tissue damage. Rationale. Beta blockers are frequently given to patients after they have suffered an MI because of their cardioprotective properties. The other responses are incorrect. A patient is going home with a new prescription for the beta blocker atenolol, Tenormin. The nurse will include which content when teaching the patient about this drug? A. Never stop taking this medication abruptly. B. The medication will be stopped once symptoms subside. C. If adverse effects occur, stop taking the drug for 24 hours, and then resume. D. Be watchful for first dose hypotension. Answer D. Be watchful for first dose hypotension. Rationale. Phentolamine is an alpha blocker that reduces peripheral vascular resistance when given systemically. But local subcutaneous injection around the site of extravasated vasoconstrictive drugs, such as dobutamine, causes an alpha-adrenergic receptor blockade and vasodilation. This allows for increased blood flow to the ischemic tissue and may prevent permanent tissue damage.